Hello and welcome. This is Ellen Teeter with the Florida State Oriental Medical Association. I'm the executive director. We're so glad you're here. We're going to be running through FSOMA advocacy for 2021. First, I just want to orient you. I'm sure most of you are familiar with Zoom, but there are several ways to communicate. The chat box is down next to the participants button. It's a little balloon over the word chat, and you'll see people in there chatting. So you can talk to each other through that. You can ask questions through that, but it's really better to go over to the Q&A, which looks like a double balloon over to the right on my screen, and it says Q&A under it, and you can type questions in there, and we'll try to answer them periodically as needed. We are recording, just so you know, and that's it. I'm going to introduce Jennifer Broadwell. She is the advocacy chair and excuse me, for FSOMA and for the ASA, which is the American Society of Acupuncturists. And she's going to be leading the charge. I'm going to say a few things as needed, but here we go. Jennifer, welcome.
Thanks so much, Ellen, and thanks for everyone for joining us tonight. We are going to talk about our advocacy goals for 2021, and we broke this up into quarters this year. And so our third quarter goal was for in-district meetings with your legislators. So let's talk about that tonight. So let's see if I can get this to cooperate. All right, so FSOMA's role in advocacy. We are really here to be the voice for the acupuncture profession within the state of Florida. We are here to work with state-specific advocacy. And, you know, we compete with thousands of organizations, meaning that we are the ones that are representing licensed acupuncturists in Florida. And we've got a lot of other healthcare professions that have really active and very well-developed trade associations that are supporting their needs. So in that sense, we do need to compete with, you know, whether it's physical therapists or nursing or any of the other health practitioners that have larger organizations. So it's really important that FSOMA is here to be able to work with us and work for us. So state-specific advocacy and state licensure, some of the reasons why this is so important that we are overseen by the state of Florida and by specifically our Board of Acupuncture is that that's who's really granting the power to give us the license to practice, that ability to practice. They can also take that away if there are any disciplinary actions that happen. So they really help to set the bar for what practice is in the state of Florida, and their number one goal is really to protect patient safety. So they are there to establish that minimum standard and to make sure that that is met, that bar is met. And what they also do is they help to enable some data collection. So that helps FSOMA understand how many acupuncturists are within the state, kind of what we're doing within our practice, how many patients we're seeing, what kind of work we're doing here, so that we can get a better understanding of what kind of laws, rules, and expansions we're looking for. So whether that be for increased insurance coverage, or whether that be for increased Medicaid coverage, or some of these others. And FSOMA impacts our statewide outcomes really in three ways. We have our grassroots advocacy, which is you guys. That is all of us that do our member level lobbying. So when we go out and meet with our legislators and whatever form that takes, whether that's letter writing or meeting with them up at Acupuncture Education Day or meeting in district, and then also a professional lobbying. And we are very lucky to have Corinne Mixon out of Rutledge and Ascena, who does work with FSOMA and has for, oh gosh, Ellen, maybe you can correct me on this, but for more than a decade, Rutledge and Encina has been working and representing FSOMA in Tallahassee. And
Well,
we are
the Mixons formerly, and then Corinne joined them, and then she moved to Rutledge. So Corinne has been there quite a while.
yes.
Yeah, definitely.
Yeah. And they're very well versed in our Florida practice, and they are huge proponents for the practice of acupuncture in the state of Florida. And we are so grateful to the work that they do. And then we also have some political action and campaign contributions. So that can be the contributions that FSOMA is actually donating to individual campaigns. And that also takes the form of our political action that we have now, the PAC that we formed earlier this year in 2021, and that is the Florida Health Alliance, which also allows us to make some greater contributions in the legislative realm. And our grassroots advocacy effort. So this is our advocacy and legislative committees that we have here at FSOMA, which are very active. Our annual conference, Acupuncture Education Day, which we held our 20th Acupuncture Education Day this year, letter writing campaigns, in-district meetings, also public testimony within legislative committees, which we've had several of our members go up and actually provide testimony when it was necessary and appropriate for legislation, and also any of our political actions. So meeting with your legislators, you've got two ways that you can really meet with them. You can either meet with them in the Capitol, or you can meet with them what we call in district. And this is really once the legislative session is over, and that did complete in April of this year for Florida. So now everything is what we consider in district. And what that means is these legislators are now at home. So they are in all of our local areas. So my representatives are right here in Palm Beach County. So they're very close, and I can get to them easily. And so can you. So in-district meetings have a couple of great advantages. It means that we can meet here in the local office versus traveling up to Tallahassee. Oftentimes, we're going to have a lot more time to discuss with them because they're not going to be in between committee meetings. They're not going to have nearly the same level of activity that's happening up at the Capitol in their local offices. And because of that, there's going to be a lot less distractions. So when you go to meet with your legislator here in district, you're going to follow a really similar process of calling their local office and asking to meet with them, and then setting up a meeting time. And you can do that over email, or you can do that via phone, depending on what the preference is for your office, but give a call and find out. And once you're there at that meeting, you really want to just make this personal. You know, this is a great opportunity to really just meet with them individually, one-on-one. You can ask if they've ever had acupuncture. You can ask what their experience was like. And you really want to tell them about your practice. So where do you practice? Why did you become a licensed acupuncturist? And who do you treat? What is your day-to-day like? So a great example for me would be, you know, hi, Representative Schlossberg. My name is Jennifer Broadwell. I'm a licensed acupuncturist in Palm Beach County, and I treat veterans, and I am passionate about bringing non-pharmacological approaches to pain for our veterans in this community. You know, and it's a great way to really personalize it because you really are their constituent. So you want to get to that personalized level. Ellen, I see you on there.
Yeah, you can even, like Representative Boyd and I talked about being kids in Florida and growing up in orange groves with sticky stuff all over our faces at Christmas time, because that's when the oranges come out and we'd go out. So, you know, you can make it very personal. It doesn't have to be all a formal kind of thing.
It really doesn't. This is a great opportunity to ask about their interests, or if you have gone online to myflorida.gov and seen any of their bio information. I know a few years ago when I met with Senator Radar, I went on firsthand to kind of get an idea of what committees he was on, and it listed some of his interests there. And he is very interested in beekeeping. So it became a great conversation starter to start discussing farming, pollination, and it went some really interesting directions that was a really nice personalized conversation. It doesn't have to be a strict agenda of wanting to really discuss specific legislation, because at this point we don't have that. At this point, what we want to do is start to make that connection, so that when we do have some legislation we want support on, or that we really want their ear on, we have this existing base foundation of a relationship. So some of the resources that FSOMA can do to help with this process, we have at our website, and that is FSOMA.org, www.FSOMA.org. We have the My Lobbying Worksheet document, and this is an organizational document that will help you be able to just quickly catalog the information for your representatives. So what are the in-district addresses, phone numbers, contacts, staff members, and also all of that same information up the Capitol. So it's a great way to keep it all organized. There's also a spot in there to list what committees they're on. And then we have the Visiting Your Legislator document, which will really go through a lot of best practices with you. So how to set up those appointments, some great reminders for what to do. Always be polite, bring a pen and paper so that you can take notes of anything. And, don't be afraid if they ask you a question that you don't know the answer to, just jot it down and let them know that you will follow up. And it will also walk you through what to do, not only just during your meeting, but also after your meeting. So you do want to write that thank you note to them. It can be email, can be a little note via snail mail, but you want to just reach out with that personalized touch again. Make sure that you have their name and title listed correctly, and we can give you those details. It's all listed in that Visiting Your Legislator doc for how to address that and write that. But that's really how you start to develop that relationship, so that when the time comes that we have that ask, we already have some people that hopefully know our names, and certainly we know their names and how to contact them, so that when we need them, we know exactly where to go. And hopefully there's that recognition so they can respond to us in kind. So lobbying and advocacy on behalf of the profession over many years is the only way really to ensure our practice environment. And it's really not possible without you. It takes each and every one of us to get out there and advocate on behalf of our profession. The more relationships that we have out there, the better suited we are, not only for the things we want, but also for the things that we don't want. Every day we're advocating for our patients. We're letting them know what we think a good care plan is and why it's important and how we can help in their health. And we really have that same responsibility to do that in terms of our profession as a whole. We need to know who our legislators are. Our legislators need to know who we are and why we're important and how we fit into the healthcare system of Florida. And so the best way to do that is to go out there and meet them. It all starts just with that basic introduction, just hi, my name is, and starting a quick conversation. So an in-district meeting, especially at a time like now where there isn't a specific ask, is really the most powerful way to set up that framework and that foundation that we can build on. So please join us. And if you have questions, reach out to us. And certainly afterwards, share your experience. Let us know how it went. We love photos and any kind of quick, e-blast, social media blast. Make sure you ask your representative if they're okay if you take a photo and put that onto social media. But that sometimes helps let us all know what you're doing and inspire us to do the same. So we can't wait to hear about your experience.
Yeah, I want photos. They expect you to ask for somebody to take it. A staff person will come in and be looking for you to hand them your camera so they can take a picture. So just be sure you do that. Are there any specific questions? Is this the end of the PowerPoint? Jennifer?
It is. This is now we just get to talk any kind of questions that anyone might have.
I think what I'll do is share the legislative page just so people are familiar with it.
Excellent. Then I'll stop sharing, Ellen.
It'll take just a second. And, you know, the nuts and bolts are pretty easy. You go to FSOMA.org and you go down on the More tab to the legislative campaign. And I'll share that now that I've got it open. I'm also David Bibby is in the room, and I am going to promote him to a panelist and let him talk if he wants. So welcome to FSOMA President David Bibby. We may not be able to see his smiling face. We'll see. Yeah, hey, David.
Evening all. Thanks, Ellen. Jennifer, great job. That was a wonderful presentation.
Hi, David. Great to see you.
Thank you. Thank you. As somebody who's made a lot of legislative visits, like you and me, we know how easy it is. If everybody's their first time, it's like sticking your toe in the water. But these people are elected to represent your interests, both personal and professional in the district. And they really do welcome visits from the constituents, and they're very approachable, especially this time of the year. They don't have a million things like Jen said. Calendar isn't super crammed. So if you ask their staff for an opportunity, it'd probably just be a matter of days. You can stop by, mostly probably whatever's convenient for you. They'll have a spot. 15
now,
minutes.
David, you are in a little more, not quite as populated area as some, so it might depend on your area.
Okay, yeah. I don't want to be unfair to somebody who maybe has a very, either somebody who has a lot of chair responsibilities, depending on where they fit into the legislature, whether it's House or Senate. Some people are more busy than others. But like I say, if they're in the leadership, they're harder to find than somebody that's a junior. But frankly, those junior elected legislators are tomorrow's, leadership. And so developing relationships early on with people who don't have a full calendar really can pay dividends. So let me leave it to Ellen to describe how to navigate the FSOMA legislative campaign site so that you can identify who and where your legislators are, so you can contact them directly.
If you just go to FSOMA.org, there's all the tabs across the top. You go to More and go down to Legislative Campaign, and you'll come up here. If you log in, you'll have to, the same bar will be at the top. So no matter where you are, pretty much you'll have this menu. So we've got, whoop, I just got a tricky mouse here. We've got the legislative campaign with the lobbying worksheet, which can help you track who you've talked to, a sample letter, how-to kit, which is basically going to be a PDF that you could download that will tell you how to do it. We've also got click here to find your state representative, click here to find your senator. What you do is you email their aide or their office and follow up with a phone call. And if you're having trouble getting a response from somebody, let me know and I'll connect you with Corinne Mixon. She's the lobbyist and she's happy to help us get the meetings if for some reason we're having trouble. So don't be discouraged. If for some reason you can only meet with an aide, that can be just as good. I made some great connections with Senator Galvano's aide, and he went on to become the Senate president. And that served us well for getting in with meetings while we were in Tallahassee. So this is kind of where your resources are. And this is what we're doing this quarter. We'll be having some talking points towards next year's for the 4th, but this is summer and we need to see these guys. So take some time, and I'll stop sharing and let me know if you have some questions. I don't see any Q&A questions, but
Helen, I think we've got a question in the chat here about an update on Ohio and New Mexico legislation. So if we've got a moment here, I'll be happy to go into that.
yeah, if you could just go ahead and give a recap.
Absolutely. So New Mexico had legislation introduced this year that sought to basically deregulate. And so acupuncture was one of several professions that was included where they were seeking to abolish the Board of Acupuncture as their oversight. And instead it was going to be replaced by some as of yet unnamed supervision. And so it was unclear kind of what that would be. And we are happy to announce that that bill has quote unquote died in committee, which means that that is gone for this year. So whether or not they seek to try to reintroduce that again next year or something similar is yet to be seen. But as of this year, that threat is passed. And, you know, it's for Ohio's was quite different. Ohio's board, also in an effort to deregulate, they actually did remove one of their licensure types. And it was the type of license that was known as Oriental Medicine Practitioner. And that's where their herbal medicine regulation was specified. That did pass. It passed in December of 2020 and went into effect in April of 2021 here. And they are now trying to get a new bill that will seek to reinstate that designation of Chinese herbal medicine listed within a tiered licensure system of their licensed acupuncture in Ohio. So they are currently working with who they hope will become their sponsor. So they do have someone identified in the Senate that is willing, engaged, and is wanting to participate in that. And what Florida can learn from both of those situations is really the importance of knowing who our legislators are, them knowing who we are, and of understanding our practice in the state and what that means. So, you know, that is we couldn't ask for a better way to frame this wanting people to go in and do in-district meetings right now than to use those two examples. And it's unfortunate, and it certainly was not planned this way, but it's a great illustration of why this just is so important that each of us is out there and making those personalized contacts within our representatives and letting them know who we are and what the value of our services is within the healthcare system. And thankfully, we're hopeful in both states, but that is something that we certainly want to avoid in the state of Florida. And so far we have been able to, and we want to continue that. And not only do we want to continue to avoid those issues, but we want to continue to deepen our relationships and hopefully find ourselves in a position where we're actually increasing not just our practice and or our scope, but also our ability to reduce the barriers to care, to increase that access, you know, to expand where we show up in mandated insurance coverage, in state Medicaid programs, as well as hopefully Medicare at some point. So it's really important that we do hold these types of meetings and have those relationships, take the time to develop those relationships. So good news from New Mexico, and hopefully we are going to be seeing some good news out of Ohio shortly, but we'll keep you posted.
Okay. Yeah, there's some information in there from Galena, who has been very familiar with this. So this is why it's important for us to get to know. You know, we have a lobbyist. We have 7 board members right now. We can't cover the whole state. Much as we try to do everything, we can't. So we need members to get out there and just make these meetings, get people familiar with who you are and what you do and the power of our wonderful medicine. So, all right. I don't have anything else. Jennifer, David? All right. Thank you all.
I was going to say one thing quickly. I was, you know, if I could piggyback on what Ellen's saying, is that the power of the profession to advocate as individuals and providers is transformative. You know, with students and professional members accounted for over 500 people, that's basically 1 in 6 or maybe 1 in 6.5 people who have a vested interest in a personal invested interest in the profession. That's not to account the tens of thousands or more patients who rely on our care on a regular basis. I mean, there's a lot of need being met. And I think if I could just bring us back to the early comments that Jennifer made about us, basically competing for attention with the legislative electorate over issues, over, occupations, over everything from, springs and environmental issues to financial issues. There's an enormous rainbow of issues that clog up the legislators' minds. And in constituents and special interests, big and small, all competing for their attention. And one of the challenges that we have as a slightly undersized profession compared to chiropractic, massage, nursing for sure, physical therapists for sure, just by percentages, we don't have the same number of bodies to fill that space. So it makes it increasingly important that everybody who has a vested interest takes 1 or 2 days a year out of their calendar, just take lunch and walk down the street to see their elected legislator. And the reason is that when something happens, whether we're proactively seeking something that expands and broadens and strengthens our scope, or we're trying to defend decision-making from outside influences, like Jennifer was describing, that things that happen in Ohio or in Nevada, is that if we don't have at least somebody who recognizes our face and our name in that office, we're always chasing the train. And as somebody who's been in a legislative role and been in an advocacy role for over a decade for the profession, I've been forever chasing the train, because I'm one of a handful of people, like Ellen was just describing, who are trying to hold this down. And I can tell you that the difference, just the enormity of the difference that it would make if people who were licensed just made that phone call, went over, met the legislators, had a 15-minute conversation and just said, hey, I want to be a local resource for you. If you hear or see anything about acupuncture and you have a question, know that I'm here to help you. And leave it like that. You don't have to do anything more complicated. And if and when the time comes that we need to act urgently, now we're in place. We have the boots on the ground, and even a little bit of a commitment and relationship started with these people, where we can steal their ear just for the 10 minutes we need to create some pushback against something that might be, deleterious to the profession, or, get behind an issue that we want to push. And so your, participation is vital. It may not seem like a big thing, but every single one of us who takes that opportunity to meet with a legislator is doing, a fantastic, serving the profession in a fantastic way. All right. So, and everybody that joined tonight, I'm always preaching to the choir. It's the people that aren't with us this evening that I really want to motivate. But anybody that has questions, Ellen and Jennifer are fantastic resources, and reach out to us in any way. We're happy to give you the tools you need to be successful in doing this one thing. Okay.
Great. Thank you, David. All right. Well, we've got some people here, and I think I'm expecting pictures of your visit from everybody. So thank you so much. I'm going to end it now, and we will see you at the conference, August. But we're going to see your pictures first. So, all right. Thank you. All right.